Hey, I'm Dr. Spencer Russell.
And I'm Dr. Alex McRee with JAX Implants here in sunny Jacksonville, Florida. And today we're here to talk to you about traveling for dental implants and some of the top reasons people might be considering that. I would say the top reason the most obvious one is cost. What are your thoughts on that?
Yeah, for our out-of-town patients, I think that's the number one thing that comes up is they've looked around for this procedure. The first thing they ask about when they go see somewhere is the price. And then you start to hear something about $50,000. That's what we hear all the time is, oh, they wanted $50,000, $60,000 for me to have implants done. And so as soon as you hear that number, that's a big number. And you start saying, well, what are my other options? Let me hop on Google. And then of course, a lot of things that start to pop up are traveling outside the country. Costa Rica, Turkey, Mexico, yep. all over the place. And so we see that a lot. We've seen a lot of patients who've been to these countries and had these implants done and tried to have the teeth made and things like that.
So yes, we've seen, I would say at least once a week, we see patients that have went from out of the country, and then some of them have done well, right? And that's great, but some of them are not done so well. When that happens, then they come to you or come to us and see you for a consult. What do you do?
Yeah, it's tough at that point. Once somebody's already gone somewhere outside the country and had this done, the implants are already in there. They may or may not have teeth made at this point. And now you're kind of in a sticky situation. This patient's already spent all their money. And a lot of times it's not done great. It's not done how we would want it. There may be bone loss around the implants. There may not be enough space for the teeth. One common thing we see is that the teeth are made out of the old school material, the denture teeth, with a bar inside of it. And so these teeth are popping off. I've seen this one gentleman, and he's seen us a few times now, and his teeth keep chipping off of this thing. And so it's something that's definitely not going to last him. He just had it done about a year ago. So it's something at that point it's very tough to fix without starting completely over.
And I feel bad, and I get it. I mean, they didn't know they had other options, right? They went to a local consult, wherever it may be, and they didn't know about us, right? And they went out of the country, right? And the work was not done super well, and they can't really get back there, or they're not willing to fix it. And the fact of the matter is, they're not held to the same standards. I'm not saying that every work I've seen from out of the country is bad. It's not. But when it is, what are the ramifications? What are you going to do? And I feel bad because they come to us and say, hey, Doc, can you fix it? And well, yeah, but I'm kind of starting over, right? And they don't have the same board rules. They don't have the same insurance that we obviously have to require.
Being safe. This is a true story. We just saw a gentleman recently, and we actually had to redo his implants because they weren't done how we would want them to be done. And his whole reason for coming to see us is I think he said he flew into Arizona and he drove across the border into Mexico. And he said when he got there, he got to the dental clinic and they had to shuttle him over to some other place. He said there were like some dark alleys. He said it was really scary and shady. He said to the point where he is never gonna go back there. The crazy part to me is he stayed and had the implants done. I guess he figured, well, I'm already here now. But he said there's absolutely no way that I'm gonna go back and have the teeth made and go through all of that again. So
we feel bad, right? It's a sticky situation, and we try to help out. If we absolutely can, we absolutely will. But there's a lot of times that we're starting over, unfortunately, and then it's kind of just wasting money down the drain. So whatever they paid for traveling, whatever they paid for the implants, it's kind of not usable. Unfortunately, it's kind of like a house that's built on a bad foundation. You can rebuild the house, but the foundation's still bad, right? And so there's nothing really you can do until you're going to strip it back down and kind of start over. So that's why we're here today, is to talk about, hey, that there are other options, right?
Yeah, so that would touch into the first one. So the main reason I think people are shopping around, watching this video even, is because you went somewhere, you heard about the price, you were hearing something $50,000, $60,000 plus, and you're like, that's crazy. And so just like Dr. McRee was saying, if you're looking for somewhere more reasonable, that's what we get a lot of our patients for. We heard significantly less expensive than that $50,000 to $60,000. And just like you were saying, if you were to go somewhere else, you go to Mexico and then you're having to have this totally redone, and then come and see us, then it really starts to add up.
Yeah.
So that would definitely be one of the number one things is price. So the next one in my mind would be quality, which we were talking about a little bit here.
Yep.
So what kind of sets us apart from going to Mexico, going to Costa Rica, anywhere?
Well, I would say our before and afters. I mean, that's why we put them up online, and that's why we advocate for people to actually take a look. And we put a lot of them up, and just because I want to show that it's not just a one-off, right? And these are all patients that were done in our office, and they look great. And so it's the consistency that you're going to go somewhere, right? Travel if you're coming from Oregon or from Canada or Ohio or North Carolina, whatever, and that you're going to come here. And you're going to get what you paid for. I mean, that's really what it comes down to. You want to be confident that the doctor who's going to see you is going to treat you right with compassion, right? And also the quality, right? You don't want to come back and do it again, right? You want to come here, you want to be happy or smile, eat how you want to eat, and be done with it. And I understand that concept. I mean, it's very simple, and that's what we feel consistently we put out day in and day out. And I would say we have at least one or two a week that come here, and we do that every single time.
And then just talking a little bit about the quality of the surgery, of course, and then the teeth. I mean, obviously we're gonna nail the surgery for you. That's gonna be done well. But unfortunately for you, you're not gonna be able to tell that difference between if you had it done in Mexico versus if you had it done here, for the most part, as long as it was done decently well. But the big part of that is gonna come into the teeth that are made on top of the implants afterwards. And so the big difference, like we were talking about before, is going to be in the material. If for us, it's going to be either monolithic zirconia, which is going to be the strongest ceramic available for us, or something with a titanium bar inside of it with a zirconia sleeve over the top. So these are going to be the top of the line stuff. This is going to be the best material that you can have made anywhere, versus if you're going outside the country, you may get something that's denture teeth on top of a titanium bar. You may get zirconia, but I've seen a lot of them coming back, and it's not the greatest looking stuff in the world, and it's been adjusted a lot, and so it's not the same level for sure.
And we have a few videos touching on what teeth look good and what teeth look bad, and the difference between that. But suffice to say that zirconia is a wonderful material, but not all zirconia is made the same, right? It's kind of a little bit of a technique sensitive material. When done well, it's perfect. When not done well, it can be catastrophic. And that's not to scare you or anything, but it's true. It just needs to be done well. And Dr. Russell, heads up over our lab over here, and he takes an extreme amount of time and dedication to make sure everything is done well.
Again, this is something that we want you to last you a very, very long time, and that's why we stand behind our work. So again, so we've touched on price, we've touched on quality. I think the next thing would just be being comfortable in the situation in the office. Kind of talked about that a little bit. Traveling across into Mexico may not be the safest place in the world, but the big thing for us is when you're in our office, we're going to treat you just like we would any of our family members. I want to make this as easy of an experience for you as possible. I want you to be comfortable and happy with the decision you made, just like you were saying earlier. You want to know that you're getting what you paid for.
And it's kind of wild. We hear that fairly consistently, that someone just had a bad, awful experience at a consult. It's not like they haven't even done work, whether wherever they're coming from in the U.S. And they just. And I don't know, maybe it's an office that doesn't do this day in and day out, right? And so I would say that sets us apart, because this is what we do day in and day out. And that makes a big difference in that everyone knows what's going on, right? The person who's answering the phone knows what's going on. The person that's doing your consult knows what's going on. Surgery knows what's going on. The lab knows what's going on. Instead of someone that maybe is trying to send it to a surgeon and they don't really do it, and then they may do this once or twice a year. So it just seems disorganized, and the patient feels that, right? And so when they come here, they're wow, like this, I can tell this is not something that is a one-off for you guys. We do it every single day, and that just makes a difference, right? It's just that comfortability that you're like, all right, I know that I'm going to get what I came here for. I know it sounds so simple, and we keep harping back on that, but it is. I mean, it's a huge confidence factor.
And I think that's a good segue too. So why, we kind of touched on why would you come down? Why would you travel to Jacksonville, Florida to see us? And so our office takes care of that if you want us to, as far as the travel arrangements. How many times would somebody have to come see us if they were coming from out of town?
They can see us as few as 2 times, if that's what they want to do. So the first time they would come in, and we do a virtual consult, right? So we save that amount of time. So you can meet us, and actually you will see one of us in person. And then just to make sure it's not smoke and mirrors, right? That you're like, okay, no, I'm actually going to see those guys. And when you come down here, you will actually see us. So we do a virtual consult, make sure everything's looking good. And then you come down, you would get your consult here, just to, again, make sure, because we actually can't see in the mouth on the Zoom. Everything looks good. We go ahead and do the surgery. You would go ahead and get your teeth that day or the next day after your surgery. And we actually put a titanium bar, and that's not an extra thing or anything, but we do that for all our out-of-town patients just to make it a little bit more secure when you're gonna be out of town. And then you would heal for 90 days, 3 months. And then you come back in. Any changes you'd want, anything like that, check the success of the implants. Everything looks good, we go to final. So at that point, you can make changes, right? So anything that make sure that you love your teeth, yeah, that would be done. So it'd be just two visits. So people think that it's like it's this whole big ordeal. In some offices it is. It could be up to 10 months or something. I'm not saying that's every office, but some. And we're not rushing anything. We're not trying to go quick. It's just efficient, and that's really what it comes down to.
Yeah, big thing for us is efficiency. We know everybody's time is valuable. We want to make this as quick for you and as easy for you as possible. Yeah. And so I think that's the big thing is the 2 visits. It does 2 things. It's keeping the time frame short for you. We're talking about 3 to 4 months total, just in the 2 visits, minimizing your travel. But at the same time, it gives us a nice period where while you're healing with those implants, you have these temporaries in place, these prototypes, so you can see, do I like the way these teeth look? Are there any minor changes I want to make? Maybe I want my canines a little bit flatter. I want a little space in between my 2 front teeth. Anything like that. It gives you a nice trial period where you get to try this out, say, hey, I loved all of this. I just want to make a little change here or something like that. Or you may say, I don't really feel like these teeth fit what I'm looking for here. Can we make these changes? And so that's very easy for us to make. Everything is done start to finish in this building. All the lab work's done here, and so any changes you want to make, it's very easy for us to relay back to our lab. We make those changes, very quick turnaround for you, and then get you into those permanent teeth that you're happy that you love.
Yeah, and not that's what you're coming down here for, but the beach is about 12 minutes from the office, so people kind of make a vacation out of it, which is really nice.
Yep.
If you found this video helpful, make sure to like the video and subscribe to our channel for more.
And if you're interested in having a virtual consultation or have any questions about the process, click the link in the description below.
I'm Dr. Alex McRee.
I'm Dr. Spencer Russell.
I'm here with JAX Implants, and now you know about traveling for dental implants.